Hello everyone, myself Deepa Singh, working as Assistant Professor in High School of Pharmacy, SGVU. Today we discuss about in vitro dissolution model and IV correlation. So in previous lecture, we already covered 3-4 correlation model or dissolution model. There's a total dissolution model. Out of this 10 dissolution model, 4 dissolution model we already covered in previous lecture. And the fusion layer, zero order, and backwards model, and one is first order, and remaining we covered today in this lecture. So today we discuss about majorly remaining dissolution model as well as IV correlation, means in vitro in vivo correlation. So in this lecture we should know about what is in vivo, in vitro test, and out of this in vivo in vitro test we compare this and calculate this IV correlation. So this is the topic of biopharmaceutics and pharmacokinetics subject of 6th semester. Before starting this topic or before starting this lecture, you should know about learning object or basic objects. And in this object, different dissolution model. What is a dissolution? Including that is dissolution model or dissolution model that are used for a dissolution study, including all 10 models. Definition and significance of IV-IVC. Means why perform this in vivo in vitro correlation, including the definition and significance. Next, parameter for correlation. There's a different parameter that is used for this correlation or to correlate this in vivo and in vitro study. So you know about this parameter for correlation. Levels of correlation. There's a 3 levels and one is another additional level. So in this you should know about what are the levels and the different types of levels for this correlation. Next is development of a correlation, how you develop this correlation. In this contents of this topic or this lecture, first is definition. Definition including dissolution definition we already covered, or description of dissolution we covered in previous lecture. So in this lecture mainly we discuss about in vitro correlation definition, the significance, parameters of correlations and levels of correlations, how you correlate according to different levels, and development of a correlations case study. So with the help of this IV-IVC correlation, you just study one case study or we just observe one case study, and conclusion and reference part. This is all are the content for this lecture. Now we are starting remaining dissolution model. 4 model already we covered in this lecture. There is 5th model or next model. In this 5th model is first order model. And in first order model, the application of this model to drug distribution study was proposed by Wiebull and Friedman in 1967 and later by Wagner 1969. Means this first order majorly discovered or mainly first discovered in 1967, and later this is modified in 1969 by Wagner, but first discovered by Wiebull and Friedman for drug dissolution study. And in this model has been also used to describe the absorption and or elimination of a drug. Although it is difficult to conceptualize this mechanism in theoretical basis, means in this mainly we discuss or we know the description about absorption as well as elimination process, how this absorption and how this elimination takes place. And according to this first order model or according to this model, it is difficult to check or conceptualize the mechanism basis on theoretical part or according to theoretical study, because it's a practical based model and it is difficult to show in according to theoretical study. And the dissolution phenomena of a solid particle in a liquid media imply a surface action, means in tablet or capsule, any solid dosage form containing solid particle, and this solid particle in liquid medium and comes in a contact with liquid medium implies surface action as seen by noise between equation. Means your tablets and capsule contain some solid particles, and these solid particles come in contact with liquid particle or liquid surface area. When it comes, it shows first order or maybe imply the noise between equation. So this is the Noyes-Whitney equation, which is to show this first order kinetics or first order model. And according to this equation, dc by dt is equals to k k into cs minus c in bracket. So this is a Noyes-Whitney equation for a particle that applies in a solid. dc divided by dt is equals to k cs minus c, where c is the concentration of a solid in time t. In this, you can say that this C or concentration of a C is just this one, and solute time is required is that is T, and Cs is the order solubility in equilibrium at experienced temperature, and K is the first order proportionally constant. Means it is first order proportionally constant, and it's a concentration, and this Cs is the order in the solubility in equilibrium, and T is the temperature. After this, we can plot one graph for this first order kinetics. In this, majorly we plot time versus concentration percent drug cumulative release. So this is the time, and this is a log percent cumulative drug release. We plot one graph. When you plot this graph, it gave a straight line or first order release line, and in this, in the plot between the R's and versus log cumulative of a drug remaining with a relative gives a straight line. Means when you plot time versus percent cumulative drug release, it gives straight line with the help of this percent cumulative release versus time. And this straight line shows first order release process. And these relationships can be used to describe the drug dissolution in pharmaceutical dosage forms, such as containing water soluble drug in porous matrix. Means these graph or this model, first order model or this graph helps to describe the dissolution rate profile or dissolution of the drug in pharmaceutical dosage form, those who are containing water soluble drug, water soluble in nature and released through matrix or porous matrix in the tablet. So this is regarding first order model or fifth model. Now we discuss next sixth number model, that is Higuchi model for dissolution study. According to this Higuchi model, this is the first mathematical model that describes the drug release from a matrix system and proposed by Higuchi in 1961. Means this Higuchi model is also discovered in 1961, and it is the first dissolution model or first mathematical model that describes the drug release from a matrix system. Means this dissolution model is mainly describe the information regarding the tablet that released from matrix system, and this is discovered by Higuchi in 1961. It is the first mathematical model, and this model is based on different hypotheses. This Higuchi model is dependent on different hypotheses. When we see this hypothesis one by one, first is initial drug concentration in matrix, which is much higher than drug solubility. Means initial drug concentration present in your tablet or in a matrix is higher, or it is observing higher than your drug solubility of the drug. And next is drug diffusion takes place only in one dimension, that is age effect should be avoided. Means out of complete tablet or complete matrix, the drug diffusion, it takes place only one dimension or one side of the tablet. Next is drug particles are much smaller than thickness of the system. Means drug particles are small in size, but they are thick in nature. And next is swelling of a matrix and dissolution are less or negligible. Means swelling of a tablet or matrix and this Higuchi model are very less, or you can say that it's a negligible amount. And diffusibility is also constant. Drug is diffused in a constant rate or constant way. Next is perfect sync condition are always attained in release environment. Means the sync condition is always maintained in this model, or no changes of sync condition is required. It's always in an equilibrium condition or required condition according to environment. So these are some drawbacks for the Higuchi model. In this first is initial drug concentration matrix is higher than the drug solubility, and diffusion takes place only one dimension or one edge of the tablet, and age effect should be avoided, and drug particles are much smaller but thick in nature, and swelling matrix and dissolution rate are negligible and very small, and differentiability is always constant, and perfect safe condition is maintained by equilibrium or maybe suitable release environment. And in this study of a dissolution from planar system having a homogeneous matrix can be obtained by equation. Means if you check the study or dissolution study of a tablet in a planar system or homogeneous matrix, then this equation is the same. A is equals to D into 2C minus CS bracket close CS into P bracket close 1 divided by 2 or half, where A is the amount of drug released in time T per unit area. Means the is show that how much drug released in particular time period or particular unit area. Where D is the diffusibility of a drug molecule in matrix substance. Means how much drug is diffused from matrix system or from that particular matrix tablet. C is the initial drug concentration. How much starting drug or initial drug concentration in your tablet. CS is the drug solubility in the matrix media. How much drug is solubilized in your matrix media or in your tablet. The following graph shows the drug released through Higuchi model. According to this Higuchi model, you really draw the square root of time versus percent drug release. Means how much percent drug release versus square root of the time. And when you draw this graph, it gives straight line. This is the Higuchi model, and equation value of this Higuchi model is equals to R square is equals to 0.9634. This is the standard value of R square. If this value is in the range of this or maybe nearby this R square value, then you can see that the dissolution is away on Higuchi model, and it shows proper dissolution release mechanism or release process. And Y is equals to 22.763x minus 22.294. So it gives R square value, and this is the value for R square in Higuchi model. And graph gives straight line release, and some release can vary according to the straight line, and you plot square root versus percent release in this graph. And application of this Higuchi model, this relationship can be used to describe the drug dissolution from several times of a modified release pharmaceutical dosage form. Means this Higuchi model is describe the dissolution rate or dissolution of the drug from the tablet by modified release pharmaceutical dosage form or modified release tablet. As in the case of some transdermal system and matrix tablet, water soluble drug. When some transdermal or water soluble matrix tablet or drug are also studied by the help of the Higuchi model. Next is Hixson-Crowell model. It's the next model or seventh model, Hixson-Crowell model. In this drug particle that having a uniform size particle, Hixson-Crowell derived from the equation expressed in rate of dissolution based on the cube root weight of the particle and radius of the particle is not assumed to be constant. This is the equation. Means this Hixson-Crowell model mainly used to uniform size particle or those formulation who have a uniform size particle. And this Hixson-Crowell derived from the equation, this one, express rate and solution based on the cube root of a drug of the particle, and the radius of the particle is not assumed to be constant. Means this is mainly depend on cube root of a particle containing a tablet, and radius of a particle it's not necessary or don't assume in this Hixson-Crowell model. And when you see this equation, M0 1 divided by 3 minus MD 1/3 is equals to KT, where M0 is the initial amount of drug in pharmaceutical dosage form or starting amount of the drug. Means how much initial amount of drug or starting drug present in a tablet, and MT is the remaining amount of drug in pharmaceutical dosage form. T and T is a proportionality constant. Means MT you can say that after initial how much drug is remaining in pharmaceutical dosage form, and T is the time that is required for pharmaceutical dosage form, and K is proportionality constant. It's a plot for the Hixson-Crowell. In this plotted graph will be linear if the following conditions are fulfilled. Equilibrium conditions are not reached, and geometrical shape of pharmaceutical dosage form diminish particularly over time. Means this plot is given linear equation or not linear equality in graph or linear condition. And when we see the equilibrium condition in this graph is not reached, was it's continuously show linear line and geometrical shape of the pharmaceutical dosage from diminished proportionally over time. And in this, mainly you can say you also plot time versus percent cumulative release, similar to previous one graph. When you plot time versus percent cumulative drug release, it gives straight linear line. And next is application of this Hixson-Crowell model. This relationship can be used to describe the drug dissolution from the several time of modified release pharmaceutical dosage form. This is mainly used to modified form of pharmaceutical dosage form or modified release of pharmaceutical drug. And in this dissolution, you check for controlled release or maybe modified release type of the tablet. And in this case, some transdermal system and matrix tablet with water soluble drug. Means you can study some transdermal system as well as matrix tablet with water soluble system in this type of formulation. Means by the help of this Hixson-Crowell model, you can study some transdermal formulation or matrix tablet, also not only limited type of tablet you study with the help of this. Instead of tablet, you can also study transdermal formulation. So this is regarding Hixson-Crowell model. Next, eighth model is Cosmia-Peppers model. Cosmia-Peppers model is described in 1982, derived from a simple relationship which is described by Wiebull polymeric equation. Means this Cosmia-Peppers majorly used for those type of tablet who have a polymer in the system or drug release through this polymer system. And those type of tablet is studied by this Cosmia-Peppers model, and this is first described by Cosmia in 1983. And to find out the mechanism of drug release from first 60% of drug release data were fitted in Cosmia-Peppers model. Means in Cosmia-Peppers model, you can say that your drug release is up to 60% of 60% drug release from your tablet. And next is Cosmia-Peppers empirical expression relates the function of a time for diffusion control mechanism. Means this Cosmia-Peppers is empirical expression or relate to the function of a time of diffusibility, how much drug is diffused from a tablet in a controlled release or control mechanism. And this is a given equation for this Cosmia-Peppers equation. Mt divided by n infinity is equals to KTN. According to this equation, Mt divided by m infinity is a fraction of a drug release. Means how much drug is released or how much fraction amount of a drug released through this tablet or through this particular formulation. And the next thing is the time. Means how much time is required to release the friction of a drug. And K is the release rate constant, including structural and geometrical characteristic of the form. K is a constant, or P is the release rate constant from structural and geometric characteristics of the dosage form. The release component, which is indicating of the release mechanism, how much drug is released from a tablet and release mechanism of the tablet. Where means you can say that if release is only n is equals to 0, not 0, it's 1. If n is equals to 1, then release is 0 order or followed by 0 order. And you can say observe this release mechanism by 0 order process. And if n is equals to 0.5, then the release is best described by Ficklin diffusion. This is another equation. If n is equals to 0.5 and if you observe that it's 0.5, then you can see that release is depend on Ficklin diffusion. And this is a graph for this Cosmia-Peppers. In this, you can also plot log time versus percent drug release. In all type of graph, mostly prepared or plot by time versus percent release. In this, you also take time versus log percent drug release, and if we do a linear equation of release, and here's R square value is 0.9887. This is a standard specific value of R square, and Y is equals to 0.7393x plus 0.915, and R square value is 0.9887. An application for this Cosmia-Peppers is this equation has been used to linearization of these data from a several formulation of nitro capsule and nitro square. Means these cosmic peppers majorly used for those type of formulation who is in micro capsule or microsphere in shape, and release mechanism is takes place and linear release process in the formulation. Next is Baker-Lonsel model. In this Baker-Lonsel model, this model was developed by Baker-Lonsel in 1974 from Higuchi model and described the drug release from a spherical matrix by the equation. Means this type of model or this Baker-Lonsel model is also depend on or based on drug release process from a spherical matrix or a spherical tablet, and this is was discovered by 1974. And according to this model is described or discovered by Higuchi model, or with the maybe similarity with Higuchi model, and the drug release is majorly takes place from a spherical matrix in Baker-Lonsel model. And this is the equation for this model. F1 is equal to 3 divided by 2 in bracket 1 minus Cp divided by C infinity bracket close 2 divided by 3 bracket close Cp divided by C infinity. And you can also simplify this equation or write down this equation is equal to in bracket 3 dm cms bracket close divided by r0 to co in bracket close into t. And in this, it is the drug release amount at a time t, means how much drug is released is 80, and t is the time, and a infinity is the amount of drug release at infinity time, means how much drug release for infinity time, and dm the diffusion coefficient, and CMS is equals to drug solubility in the matrix, how much drug is solubilized to that particular tablet of the matrix. R0 is the radius of the spherical matrix, and C0 is the initial concentration of a drug in the matrix. To study the release kinetic data often from in vitro drug release study were plotted as in bracket D into AT divided by A infinity bracket close divided by dt with respect to root of a time inverse. And application of this model is that this equation has been used to in linearization of release data from several formulation of microcapsule and microsphere. Then this is also similarly used as previous one. This is used for majorly microcapsule or microsphere type of the formulation. Next, 10th or last model is Wiebull model. In Wiebull model is generally applied to drug resolution or release from a pharmaceutical dosage form, means how much rate or how much release process takes place by that particular formulation, the resolution release, and this accumulation friction of a drug by Wiebull equation. This is the equation for this model. M is equals to M0 in bracket 1 minus E minus in bracket T minus T divided by A bracket close into B, where M is equals to percent dissolved in time T, means how much time is dissolved in percentage, and A is the scale parameter which define the time scale of the dissolution, and Pi is lag time, generally 0, and B is the shape factor. This is for Wiebull model equation. And mathematical model for drug release dissolution, you can see that it's a summary of all 10 model, or not 10 but 7 model of this dissolution model. First is zero model mathematical equation is C is equals to C0 KOT. Release mechanism is diffusion mechanism. In first order, DC divided by T is equals to K CS minus C, so it's first flow diffusion mechanism. In third model, Higuchi model, equation is A is equals to in bracket B 2C minus CS bracket close CS into T bracket close 1 divided by 2, and diffusion medium based in the mechanism 6 first law. And in fourth Cosma-Peppers model, MT divided by M0 KTN. Peppers model CT divided by C infinity is equals to KTN, semi empirical model and diffusion based on the mechanism. Next is Hixson-Crowell model M0 1/3 minus MT 1/3 is equals to KT. This is release mechanism is erosion release mechanism. Sixth is Wiebull model. In this M is equals to M0 in bracket 1 minus A minus in bracket T minus T divided by A bracket close V in bracket close empirical model lifetime distribution function. And in seventh model, that is Becker-Renzel model, in this F1 is equals to 3 divided by 2 in bracket 1 minus bracket 1 minus CT divided by C infinity in bracket close and 2 divided by 3 bracket close CT divided by C infinity is equals to KT. And the release of drug from a spherical matrix takes place in this model. So this is a summary of all models, including the mechanism release or mathematical equation. Next is application in this product development. Application tool maybe during development of a dosage form or aid in guiding the selection of prototype formulation and determining optimum level ingredient achieve drug release. Particularly for extended release formulation, also guide the selection of market image or product to use pivotal in viability equivalence study. Means in product development, you study with the help of this equation, the optimum release or the mechanism, how which release mechanism takes place in extended release process in the product. And quality assurance is that DT performed on future production lots and used in assess lot to lot performance characteristics of a drug product and provide continuous assurance of the integrity and similarity. Means it also helps to provide the quality assurance of your formulation and quality integrity of your formulation. And next is product stability. And this in vitro dissolution also used to assess the drug product quality with respect to stability and shelf life. And the product each physiochemical changes dosage form may alter the dissolution characteristic of the drug product over time. And some product polymorph transformation to more stable and hence less soluble crystalline form may result in reduced dissolution rate. Means this is also used to check the stability or particular half-life, quality or shelf life of a product or a formulation, whether stable or not in a stable form. So this is regarding product stability. Next is comparability assessment, also used to assess the impact of pre and post approval change to the drug product, such as change in formulation or manufacturing process. And thus, in vitro compatibility assessment is critical to assure the continued performance, equivalence, and product similarity. Means this is also used to pre and post approval changes drug formulation and how to check this post and pre approval formulation. And a comparative study of different formulation equality of different product and formulation. Next up is favor of in vivo bioequivalence requirement. In this in vitro dissolution testing or drug release testing may be used for seeking levels of required product to conduct in vivo viability of bioequivalence study. Means for a study of bioavailability or for the study of viability and bioequivalence study, this model is also used. So this is regarding all for dissolution model, including the application. And we discuss 6 model in this lecture, including the application, and remaining we covered 4 in previous lecture. Now we will start IV-IVC correlation, means in vivo in vitro correlation. Definition of in vivo in vitro correlation, that in this in vitro dissolution, it is a process of release of a drug from a dosage form measured in vitro dissolution apparatus. Means in vitro, majorly you check with the help of dissolution apparatus or release mechanism with the help of dissolution apparatus. And in vivo dissolution, process of the dissolution of a drug in GI tract, means how much drug is released or process of a drug released in GI tract. And correlation is the relationship between in vitro dissolution rate and in vivo absorption rate as used in bioequivalence guideline. Means first you know about what is in vitro and what is in vivo. In vitro means you study the drug release with the help of dissolution model. In vivo means dissolution in the drug in GI with the help of some animal or human being. And after this to study in vivo and in vitro, we check the equability or maybe dissolution process in both in vivo and in vitro, and the relationship is known as IV-IVC correlation. So relationship between in vitro and dissolution rate in vivo absorption rate used in bioequivalence guidelines. And IV-IVC are defined as a predictive mathematical model describing the relationship between in vitro property of a dosage form and in vivo response. Means this IV-IVC is predictive response of predictive mathematical model that describes the IV-IVC response or IV-IVC correlation. Next is significance of IV-IVC. The main objective of developing and evaluating this IVIC is enable to able to dissolution test, and it reduced the number of bioequivalents required for approval, as well as during the scale of post-approval change, that is feedback. Means with the help of this IVC, reduce some bioequivalence study or approval is also reduced with the help of this. Very easy with the help of this model, and in IVC shorten the drug development period, economize the resource, and as to improve the product quality. Means time also reduced, and economy or cost is also reduced, and good quality or improved product quality is often marked with this IVC correlation. Next is a means of assuring the viability of active ingredient from a dosage form. You receive a very good assured quality of particular drug and particular viability of a drug active dosage form. Next is support or validate the use of resolution method and specification. And so you check or validate your drug is in specification of proper resolution model or not. Next is IVI says assess supporting variables. You also study the variables with the help of the IVIC correlation. This is a parameter for correlation in vitro and in vivo. In vitro, mainly you check dissolution rate and percent drug dissolved. And in vivo, instead of dissolution rate, you check absorption rate or absorption time, and how much time is required to percent drug dissolve, you check maximum plasma concentration or Cmax, and percent drug dissolve, you check serum drug concentration and Cp. So this is mainly parameter for absorption, and this is for dissolution or how much drug dissolve in percentage. So this is in vitro study, and this is an in vivo study. Dissolution rate versus absorption rate. This is a graph for absorption time versus dissolution rate. Dissolution time in R. If dissolution of a drug is rate limiting step, and the faster the dissolution rate, faster is the appearance of the drug in the plasma, and faster absorption. So you can say that dissolution is a rate limiting step, and you can say that if more dissolution takes place, then in this condition more absorption takes place, and faster the absorption is observed in plasma, and therefore absorption time and dissolution time may be considered for correlation. To consider both absorption time and dissolution time for this correlation, because it is depend on both absorption and dissolution process. And this is a graph for in vivo and vitro correlation or dissolution time versus absorption time in R's or 3 sustained release formulation. One that is mentioned by in circle, second is square, and third is rectangle. So these are the 3 sustained release tablets or sustained release formulation that release in linearity. Next is percent of a drug dissolved versus percent of a drug absorbed. In this, appropriate dissolution medium and a slow stirring rate dissolution medium should be considered to mimic in vitro dissolution. And so dissolution medium is also very important, and stirring rate dissolution is mimic the rate of in vivo dissolution. And if drug is absorbed completely after dissolution, means the drug is completely dissolved or completely absorbed after dissolution, a linear correlation will be obtained by comparing the percentage drug absorbed to percent drug dissolved. How much drug is percent dissolved or percent absorbed? Calculate in this. Next is percent of a drug dissolved versus maximum plasma concentration. A poorly formulated drug may be completely dissolved and released, resulting in lower concentration. Means any poor form drug or poorly formulated drug which is completely dissolved and released in plasma concentration or plasma drug concentration, and the percentage of a drug release at any time interval will be greater for more bioavailable drug product. Means more drug release is observed or more time interval is the greater time is required for this bioavailable drug product, and peak serum concentration will be higher for the show highest percent of a drug dissolved. And it's a graph in this percent dissolved versus maximum concentration in microgram per ml, and percent drug dissolved in 30 minutes versus Cmax of a drug, that is 9 product of phenytoin in 100 mg. Next is serum drug versus percentage drug dissolved. In this study, an aspirin absorption of a serum concentration of aspirin was correlated to percent drug dissolved using in vitro dissolution method, and dissolution of the drug rate limiting step, and various formulation with different dissolution rate has a different serum concentration of aspirin. And in this, you plot one graph for in vitro and vivo correlation of the serum drug concentration versus percent drug dissolved in aspirin. These are the levels for correlation: level A, level B, and level C. This is a 3 level, and including this, out of this 3 level, there's one multiple level for C or multiple level C correlation. Now we discuss this levels one by one. In level A correlation, it is estimated by two-step methods followed by comparison of the fraction of drug absorbed to the fraction of the drug dissolved. Means this is a two-step correlation or depend on two-step. How much drug you compare the friction of drug absorb and friction of the drug absorb, means how much fraction drug dissolve and absorb. And in this defines direct relationship between in vivo data such as measurement of in vitro dissolution rate to directly check the relationship or directly compare the relationship between in vivo data and in vitro dissolution rate alone is sufficient to buy pharmaceutical rate of the dosage form. And in vitro dissolution curve can serve as a surrogate for in vivo performance. And this is a graph for this level A correlation, percent drug dissolved versus percent drug absorbed. Hence, it is a two-step based process. You just compare percent drug release versus percent drug absorbed, and this level A correlation, and plot the relationship between in vivo and in vitro dissolution study. Next is level B correlation. In level B correlation, utilize the principle of statistical moments analysis. And mean in vitro dissolution time, that is MVT vitro of product, is compared to mean of in vivo resident time, that is MRT. In this level, we compare release absorption versus release dissolution, but in this compare MVT MRT, means in vitro dissolution time, and compare with in vivo residence time, that is MRT. And MRT we calculate as a ratio of area under force movement term, that is AUMC to the AUC. Means this MRT or in vitro resistance time we calculate with the help of area under curve, or you just check or take the value of area under curve in force movement term, that is AUMC is the required value for MRT, and you take this value with the help of AUC or area under curve. And where AUMC, that is area under curve for first movement curve, and it is the area under observed for the product of a time and concentration versus time. This AUMC is mainly received, or you can check with the help of product time versus concentration and time. And this is the mean dissolution time in R, and this is the mean residence time on R. This is the graph for level B correlation. Means you plot dissolution time versus absorption time. Next is level C correlation. The third level, in level C correlation represents a single point correlation. One dissolution time point, that is T50, T90, etc. is compared to one mean pharmacokinetic parameter such as AUC, Tmax, or Cmax. Means this level C is also known as single point correlation or one point correlation. And in this, you study the dissolution time point. And in dissolution time point, these are the parameter T50% and T90. You check, and you check this T50 and T90 and compare this parameter with some pharmacokinetic parameters. Pharmacokinetic parameters will include AUC, Tmax, and Cmax. And weakest level of correlation as a partial relationship between absorption and dissolution is established. And when we can say that this is a graph for this level, in this is plot a fraction of the drug dissolved at AR versus Cmax. This is a correlation percent drug divided in 45 minutes in AUC of plasma time curve. Next is multiple level correlation. This multiple level C correlation will link one or several pharmacokinetic parameters of interest. Means it show multiple level C is mainly depend on one or more than one pharmacokinetic parameter for interest. And this first is Cmax and second is AUC parameter or any other suitable parameter to the amount of drug dissolved. Which amount of drug is dissolved at a different point in this multiple level C you check, and with the help of Cmax, AUC, and other suitable parameters, the correlation is more meaningful than the level C, and several points are considered. It gives more appropriate and more good result when you compare with level C because it gives several point concentration, several meaningful points. Next is case study. In case study, in vitro in vivo correlation, IVC study of lifupromide loaded microsphere. There's one formulation in a microsphere form and drug is loaded, that is lifupromide. And in this parameter correlated the amount of drug dissolved in the specific fraction of drug absorbed. Hence, how much drug is dissolved with respect to those absorbed. And this is both the dissolution and absorption link of the formulation. Next is the in vitro release from lifupromide microsphere V1, V2, V3, and V4 should good sustained release property. Then we can say that this microsphere loaded lifupromide show good release mechanism when we compare V1, V2, V3, and V4 show this 4 release sustained release property. And the selected formulation when examined in vitro rabbit model, the Tmax of all microsphere increased 1 to 4 on confirming the susceptibility of property. Means this study you compare with on rabbit or with the help of some animal model. In this animal model, we take a rabbit and we check the Tmax, and when we see that Tmax is show microsphere increase rate of 1 to 4 on confirming sustainability property. So this is the study for this one IVIVC correlation in microsphere form combination. Next is conclusion. In this current IVIC study force more than development validation of A level IVC, which gives more useful information in relationship between in vitro release and vivo absorption from the dosage form. Means level A is good for when we consider in vitro release or in vivo release mechanism. And in this level B and C, IVC has been evaluated for several purposes in formulation development, for example, to select appropriate excipient, optimize the manufacturing process. And for in next point, present regulatory guideline for IVIVC is only applicable to oral conventional modified release dosage form. However, further release is necessary to develop IVIVC for non-oral product in health medicine and dermatological medicine also. This is the conclusion for this IVIVC. After completing this lecture or this topic, these are the learning outcomes that you should know about these learning outcomes. In this first, we covered dissolution model or 6 dissolution model. And you should know these all 6 models with their mechanism, with their equation, and how you calculate this dissolution study by that particular model, including their graph. So in this lecture, you should know about dissolution model or different dissolution model, including their procedure. Next is definition and significance of IVIVC. Definition and significance part of in vitro and in vivo correlation study, parameters for this correlation and levels of this correlation, development of correlation. This is all regarding the learning outcome that you should know about this lecture. Next is reference part. In this, Leon Sargent, Susanna V. Pong, Andrew Y. Applied Pharmaceutics and Pharmacokinetics, 6th edition, page number 380 to 383. Next is Sudramurthy Nair, Krishnan Rajya, Santosam Vimuthu, D. Prakara, Ravi Shekhar, Krisagata, pharmaceutical classification system, in vitro in vivo correlation, concept and development strategy in drug delivery, and Tropical Journal of Research Pharmaceutical, April 2012, 11, 2nd, 319, 329. Next reference is Rabindranath Mal, Manas Chakraborty, Ravindra Devnath, and Raijan K. Gupta, in vitro and in vivo correlation study of lifupromide loaded microsphere, International Journal of Pharmacy, Pharmaceutical Science, Volume 1, Supply 1, November, December 2009. This is the reference. Including this reference, some other reference like Hitesh Jain, Purvi Josel, Shweta Gadia, Vishal, Saturia Hira, Shaha, T.Y. Pasha, in vitro and vivo correlation, a review or empirical journal of pharmaceutical cosmetology. Next is mathematical model of drug dissolution, vivo by Ramteke, KHDV, P. Karat, A.R. Patil, SV, PS Model College of Pharmacy for Ladies, Mostly, Pune, India. Next is Remington, The Science of Practice Pharmacy, 21st edition, page number 272 to 685. And next is Brahman Text for Pharmaceutics and Pharmacokinetics, 3rd edition, page number 15 to 48. Next is CVS Subramanian, Textbook of Physical Pharmaceutics, second edition, Balla Prakashan, page number is 85 to 109. These are the reference for this topic, including resolution model and IB-IBC correlation. Next is question part. This is similar for this topic. After completing this topic, we answer this question. In this first question, which theory of resolution is known as limited solution rate theory? First is surface level theory. B is diffusion layer model. Third is Hixson-Crowell model. D is interfacial barrier model. In second question, therapeutic equivalence drug do not have a same dose strength. B is the same safety profile. C is the same clinical effect. D is the must a pharmaceutical equivalent. In third, the elimination of a drug by saturable enzyme process described by A. Michael-Menten equation. B is Michael-Thomas kinetics. C is Michaelis-Henderson kinetics. D is Michaelis-Severson kinetics. Next, fourth question is the drug type for which microsomal oxidation is the most prominent. A is a lipid soluble, B is water soluble, C is a low molecular weight, and D is a high molecular weight. Next, in fifth question, if the drug shows small volume of distribution, it is likely that drug is a short biological life. B is does not accumulate in various tissue and organ. D is not bioavailable, and not C is not bioavailable. D is will not be effective. In sixth question, passive diffusion is expressed by a fixed first law of diffusion. B question is fixed second law of diffusion. C question is first order kinetics, and D option is zero order kinetics. In seventh question, as per BCS classification system, class 1 drug come under A option is high solubility and high permeability. B is low solubility and high permeability. C is high solubility and low permeability. And D is low solubility and low permeability. Next, eighth question is which one of the equation used to identify the drug release from a dosage form? The option is Henderson-Hasselbalch equation. B is Higuchi model. C is known as Whitney equation. D is Hixson-Crowell model. Next, ninth question, which one equation is used to identify the drug release from a dosage form? A option is Henderson-Hasselbalch equation. B is Higuchi. C is known as Whitney. D is Hixson-Crowell. And in last 10th question, based on Hasselbalch equation, at which pH value weak acid would be 99.9% ionized. In A option, at pH equivalent to pK minus 3, and B is at pH equivalent to pKa plus 3, at pH equivalent to pKa minus 1, and D option is at pH equivalent to pK plus 1. So this is the four option. You select any one correct option. This is all regarding the question part of this topic, including resolution model and IB-IBC correlation. After complete this topic or complete information regarding this IB-IBC correlation, you easily answer this question. This is based on this topic. So this is all other questions. So thank you so much for watching and listening this video. Thank you everyone.